If you're frustrated with ongoing back pain and you want to become pain-free again, then this video is for you. My name is Tommy Brennan. I'm the owner of the Pain and Performance Clinic based in Dublin, Ireland, and I specialise in back pain. In this video, I'm going to show you 3 vital movements and exercises that you really need to be able to do well in order to become pain-free. The approach we use here is the most evidence-based approach towards low back pain, and it comes from Curtin University in Australia by lead researcher Peter O'Sullivan. Peter has published over 400 papers and spoken internationally on all things back pain and ongoing pain. Back pain is a very frustrating condition for people, and it's one that often lingers for a long time and has a major impact on people's lives. People are ill-equipped to be able to cope with back pain and be able to reduce their own symptoms. We see people here every week who've suffered for a long time and they've no understanding about why they have pain, and therefore they have no tools themselves to try and help themselves, even though back pain limits them from doing lots of activities in their life that give their life meaning. At the end of this video, I want you to have some actionable steps that you can start using today in order to help yourself. It's often important to understand it a little bit more in order to do these exercises, but for some people, if they don't do this, they're going to struggle with anything else that follows up afterwards. There are so many myths out there surrounding low back pain and a lot of commonly held beliefs that are very unhelpful. We're not going to get into those today in this video, but this video is going to require you to be open enough to allow your back to bend and move. One of the most common things we see in people with ongoing low back pain is an increase in muscle stiffness around this trunk area. So what happens to muscles that are tense all the time? Think about it yourself. If you tense muscles, if that's ongoing, those muscles are going to become sore and weak. Let's use the fist as an example. So if I use my fist here and I'm moving it nice and freely, that's all okay. But what if I tense the muscles around my fist? This is going to be okay for a while, but pretty soon it's going to start getting sore. Now, if I try and move it with that tension, I can still do it, but it's kind of clunky and effortful. If I keep it like this, what might I feel? It might start off with some pain here, but if I keep that for a prolonged amount of time, where would I feel my pain? Obviously, I could feel it spread a little bit here. So say if we keep with this example, and I have these muscles stiff here for the next 5 or 6 hours, and then I go to use both arms working out. Which arm is going to get sorer quicker? This one, because the muscles are fatigued and weak because they've been tense all the time. This is just a much more obvious example of what's going on with a lot of people with the low back muscles. This increase in muscle tension happens for a number of reasons. The first reason is the popularity of core stability and core strengthening exercises. This has become popularized in both the physio and fitness world over the last number of decades as a way of both treating and preventing pain and injury. Some of this came from research into very heavy lifting, with the correct information that you should brace this area if you're lifting extremely heavy loads. However, people have taken that information and now have stiffening in around their trunk and low back area for ordinary everyday activities, which leads to that tiredness and weakness around the joint that we spoke about earlier. The second reason is the well-intended but misinformation from health professionals and Dr. Google on the general outlook and approach towards low back pain. Low back pain is treated as if there's something wrong in your spine. There's an instability there, there's damage there, there's something that needs to be protected. This is the narrative, so naturally, going from that narrative, people are stiffening and bracing that area. That narrative causes people to feel more fragile around their spine, worried and fearful. And all of that approach tends to increase stiffness around your low back. The third reason is our natural reaction as human beings to some area being sore. It's perfectly normal and natural that if you, for example, have a sore shoulder, you'll generally tense up around that area a little bit more. Having that little bit of tension is fine for a while, but in people with low back pain, they generally move stiffer and slower and more cautiously even when their pain is gone. So if you've had a flare-up of low back pain and that pain subsides or reduces, it means you don't go back to moving normally and freely like you might have beforehand. That experience of low back pain can leave you moving stiffer and more protectively and cautiously. It's much more obvious if, for example, in the example of the wrist. The issue is when it comes to low back pain, you can actually move and do your everyday tasks with a lot of stiffness around this area without necessarily being very obvious. So ultimately, if you're moving in a lot of your daily activities with unnecessary muscle tension in the muscles in your back, most things are going to get sore. Let's go back to our fist example. What's the first thing you would advise someone to do if they moved around like this all the time? It wouldn't be just movement. What's the first thing you have to do? It's to take tension out of the muscles. The really good news about this is you can do this yourself. So if there's tension in these muscles here, you can't click it better, needles aren't going to sort that. Heat might give it a bit of short-term relief, but ultimately who's in full control of relaxing your muscles? It's you. So this gives you control back in relation to your low back pain. We're now going to go through these exercises and activities to try and nail initially so that you can move on with a pain-free life. The very first one we're going to do is how you're sitting in a chair. A lot of people are sitting up quite straight with tension in their back. So as you can see here, what I want you to do is sit back into a comfortable chair and just try and let your back muscles relax. Now this is difficult for a lot of people. A lot of people, maybe out of beliefs, sit straight like this, or the ergonomic chairs are very popular, which keep you kind of upright, and the ergonomic advice. But here, to get rid of your back pain, I'm going to ask you to get a comfortable chair, sit in and allow those muscles to relax. I want you to try and breathe really slowly and calmly. So there's two questions you're going to ask yourself. You're going to sit in nice and comfy, and you're going to ask yourself these two questions. Am I breathing? And are my muscles relaxed? Just take 3 or 4 minutes or 2 or 3 minutes to try and do that. Get comfy in a chair, take the tension out of your muscles. If you can, breathe in through your nose and just slow it right down. Am I breathing? Are my muscles relaxed? That's exercise number 1. So the reason we did that for exercise number 1 is now I'm going to be asking you to ask yourself those 2 questions in all other movements that you do. And for that to happen, generally you need to be able to do it in a nice relaxed position. So whether you're sitting, whether you're lying down on your side or wherever it is, am I breathing and are my muscles relaxed, and just slowing your breathing down. Now we're going to do that in a movement. So here, you're going to sit halfway out your chair. Again, asking yourself those 2 questions, hands on your knees, lead with your chin and just allow those back muscles to bend. So you can see these muscles here as I just calmly bend down and back up. And you're doing it slow and relaxed. It's not an exercise you want to just rush through. You should try and feel a gentle little stretch there. When you feel that, don't worry. It's not any sort of damage. It's the muscles just getting a little bit of a stretch. So, am I breathing? Are my muscles relaxed? Nice and slow and relaxed, trying to feel that little bit of a stretch there. When you're done with that, just sit back in. And again, just try and relax. So, the first 2 parts are, we've done the relaxed movement, sitting in the chair or lying on your side. You've taken the tension out of those muscles by asking yourself those 2 questions. Am I breathing? Are my muscles relaxed? We've also done that very gentle stretch exercise that can be easily done sitting on a chair. But you'll have limited benefit if you just do that and then get up and move about in your day with a lot of tension. And this is what we see in a lot of people. So they're doing their exercises, but then as they move about in the day, they're back with those habits of unnecessary muscle tension. Like I mentioned earlier in the video, it's quite easy to move around without it being obvious and have tension in your muscles here. Like I can do this, but my back is going to probably get a little bit stiff and achy and sore after a while. So this is something that can be difficult for people, but I want you to walk. Again, asking yourself those 2 questions. Am I breathing? Are my muscles relaxed? You're letting your arms swing and you're just trying to be loose. Just move loosely as opposed to that sort of stiff, cautious way a lot of people with back pain move. So in your activities, you're moving nice and slowly and relaxed. Move fast and relaxed, doesn't really matter as long as you're moving freely. And the best way of doing that is just to be a little bit more aware of it. And again, coming back to those two questions as you're walking, are my muscles relaxed and am I breathing? So in summary, if you're moving around with a lot of unnecessary tension in the muscles in your back, lots of activities are going to get sore and you're going to have a sore, ongoingly sore, achy back. The good news about this is that you can take away that tension. You don't need anyone else to do it for you, but it's something a lot of people aren't aware of, and it's not as easy as it might seem for some people. Practicing those two questions, am I breathing, are my muscles relaxed, in lots of your simple everyday activities, sitting nice and comfy, walking around the place. Taking the tension out of those muscles is often the first step to getting your life back when it comes to this ongoing back pain. Stay tuned to the other videos as we bring that thought into more advanced exercises where you have to be able to bend and lift with your muscles nice and relaxed. But the starting point is here in this video today. If you have any questions or comments, I'd be happy to help. You can just leave a comment below.